Both of these are effective, and in Ontario, and I believe a lot of places in North America now, you're able to get them for free. And so, meaning you'll be able to get free tools to help possibly save a life and help someone in crisis as the paramedics get to them. So, aside from that, well, what do we as paramedics do differently? And the two things I want to talk about are not the only two options that we as paramedics have as treatment options, but they require equipment that are not normally available to the general public. Now, the first option is supplemental breathing using a BVM and oxygen, a BVM being a little bag that we have that we can squeeze and onto a mask that kind of pushes oxygen into the lungs of our patients. The thought process behind this is that the lethal attribute of the drug is extremely lowered rest rate and lack of oxygen delivered to the body. Therefore, depending on the severity of the overdose, instead of drawing the patient awake, risking harm to the paramedics, to themselves, others, and risking the patient then denying further treatment and leaving, only to overdose somewhere else, we might opt to help the patient breathe by squeezing oxygen into their lungs and maintaining that healthy oxygen and CO2 levels. The other option I want to talk about isn't one that is commonly used or one that I've seen during the overdoses that I was a part of, but it certainly is a treatment option that's available. And this is the titration of Narcan through an IV. Now, the reason why some paramedics will opt for this option is kind of to circumvent the consequences of suddenly reversing the fentanyl drug, and they will start to slowly introduce the Narcan into the system so as to improve respiratory function while reducing the risk of sudden outbursts of violence